Hello and welcome to today's webinar, Are We Ready for the Next Cross-Border Health Crisis? 3 years ago, in the midst of the COVID-19 pandemic, one message that started to emerge was never again. That when the next health crisis struck, Europe must be better prepared to respond to minimize its impact and recover in a way that does not exacerbate health, economic, or social inequalities. Evidence shows us that this type of epidemic is occurring more often, and that we are also exposed to the risk of biothreats, deliberate release of biological agents by bioterrorists or rogue state actors. And it is very clear that this type of health threat does not care about national or regional borders. And so when we look at the work that's being done in Europe to prepare us for the next cross-border threat to our health, what approach are we taking to strategic crisis management? How are we predicting and monitoring risks? And is it clear who's doing what and how we're working together? To answer these questions, we draw on 3 recently published reports on strategic crisis management in the EU. You see here on the left, the evidence review report from SAPEA, part of the scientific advice mechanism, which together with the group of chief scientific advisors provides independent scientific advice to European commissioners to support their decision-making. Here in the middle, you see the scientific opinion from the group of chief scientific advisors to the European Commission. And on the right, the statement from the European Group on Ethics in Science and New Technologies, Values in Times of Crisis. So these reports go beyond health threats. You may have joined us for earlier webinars which addressed other perspectives. You can find the recordings of those on the SAPEA website. But for today, our focus lies firmly on health. And we are delighted to welcome 6 people for whom these challenging questions are very much at the heart of their work. Simo Nikari is a professor at the Center for Military Medicine in Finland, where he is Director of Research and Development and has led the Center for Biothreat Preparedness since its establishment in 2005. He's also a member of the SAPEA Working Group on Strategic Crisis Management in the EU, who put together the evidence review report. Maria Jeftic is from the Serbian Academy of Medical Sciences. She is co-chair of the One Health Subcommittee on Environment for the Federation of European Academies of Medicine, FEEM. She's a collaborator at the Research Center on Environmental and Occupational Health, part of the School of Public Health at the Université Libre de Bruxelles in Belgium, and she's based at the University of Novi Sad's Faculty of Medicine. We also have a video message recorded specially from Sara Cerdas, a Portuguese member of the European Parliament in the S&D group, and also a medical doctor herself. Joining us too will be Anne Simon. She's head of unit for HERA's emergency office. So HERA is the European Commission's Health Emergency Preparedness and Response Department, set up recently since the COVID-19 pandemic, to prevent, detect, and rapidly respond to health emergencies. We're joined by Thomas Hoffmann. He is head of section for emergency preparedness and response support at the ECDC. That's the European Centre for Disease Prevention and Control. That's the agency of the European Union that works to strengthen Europe's defences against infectious diseases, based in Stockholm in Sweden. And the World Health Organization, of course, develops global strategies for the prevention and control of epidemic-prone diseases. And we're very happy to welcome Sylvie Briand, Director at their Department for Epidemic and Pandemic Preparedness and Prevention. My name is Michael Creek from Sticky Dot. I'll be your moderator for today. And we would also love to hear your thoughts. This webinar is a chance for you to share your views with our panelists. We'll be using a fishbowl format, which means you can join the conversation live on screen. So perhaps first I can ask you to now type in the chat to introduce yourself, your organization, and what brings you here today. What's your interest in today's topic? Make sure you use the option to everyone so that we all see your comment. So please do go ahead now and introduce yourself in the chat. And then later during the webinar, you can simply post your questions and comments directly to everyone in the chat. Again, using that option to everyone, so that your questions and comments are all visible. Our team will be making a selection, and some of you will be invited to join our fishbowl on screen to discuss your points with our speakers. We are recording and streaming today's discussion, and it will be circulated afterwards via the SAPEA website. So we're looking forward to a lively discussion, but first of all, I'd like to introduce Simo Nikari from the Center for Military Medicine in Finland for his opening words. Simo, are we ready for the next crisis?
Thank you, Michael. Well, are we ready? What is actually a cross-border health crisis? Well, it refers to a situation where a health crisis occurs in one country and spreads to another. It's a situation. These serious threats to health are in many cases caused by naturally occurring infectious disease outbreaks or environmental factors. On a global scale, infectious disease epidemics are occurring more often and spreading faster and further than ever. As the COVID-19 pandemic has reminded us, serious epidemics or pandemics caused by communicable diseases do not respect man-made borders. In a bigger context, the need to strengthen national capacities for health risk is an integral part of the United Nations 2030 Agenda for Sustainable Development and is linked to many major global processes. The need for countries to have the capability to prevent, detect, and respond to all hazards, regardless of cause, is underlined by the WHO international health regulations, the performance of veterinary services of the World Organization for Animal Health, the commitments made through the Sendai framework for disaster risk reduction, and, for example, the Biological and Toxin Weapons Convention. I have myself been working on development of external evaluation processes in support of the IHR and as a Finnish national expert of the BWC. For example, the purpose of the external evaluation is to measure country-specific status and progress in developing capacity to prevent, detect, and rapidly respond to public health threats, be they naturally occurring, deliberate, or accidental. Although in this seminar we focus on naturally occurring infectious diseases as serious cross-border threats to health, these serious hazards to health include other biological hazards such as antimicrobial resistance and malicious or accidental spread of biological agents, as well as chemical and radiological agents possibly spreading across the national borders of EU member states. These may cause threats to the environment, animal or human health, and security. In fact, taking the COVID-19 pandemic as an example, the cause of this pandemic has not been yet definitely answered, and we might even never learn to know it as a scientific fact. To my mind, this demonstrates lack of confidence and mechanism between countries in mitigating the risk caused by biological agents. Why is knowledge on the origin of the disease important? Well, so that we will be able to more effectively prevent such pandemics from occurring in the future. Raising awareness on possible malicious use of biological agents, biosafety and biosecurity, as well as on potential dual-use research of concern is important not only in global processes. Awareness and understanding on potentially harmful research should be raised in the minds of the public, of each scientist, principal investigator, funding agency, the industry, and academic institutions. Legislation just cannot keep up with the extremely rapid development of life sciences. Education and self-regulation is needed. Most emerging epidemics are zoonotic, that is, infectious diseases of animal origin. We clearly need to tackle the current threats to health security by adopting holistic, multi-sectoral, One Health, whole of government, and even whole of society approaches, as we do in Finland, with a high-level commitment to secure its implementation. Strengthening essential public health factors and international health regulation core capacities are integral parts of these broader efforts to strengthen health systems and resilience against cross-border health threats. Finally, a few words on biothreats. Before the current pandemic, preparedness mainly focused on preparing for an influenza A pandemic. In fact, with the global human population exceeding 8 billion people, the right question to ask now is not whether there will be a new pandemic, but the big question is, what will the causative agent be? A new coronavirus, influenza, disease X? And when will it happen? In addition to biosafety, that is how people are protected from microbial infection, efforts should perhaps focus also more on biosecurity. That is how microbial agents are protected from falling into the wrong hands. Thank you.
Thank you very much, Simo, for already raising some really key questions that we'll be getting into in just a moment. Next, it's my pleasure to hand over to Maria Jevtic from the Serbian Academy of Medical Sciences. Maria, what are your thoughts?
Thank you very much. Yes, this is a fact. On a global scale, infectious disease epidemics are occurring more often and spreading faster and further than ever. Also, the fact that threats to public health don't stop the national borders, as shown by the ongoing COVID pandemics, and we are aware also that that the WHO announced that the COVID pandemic solved a few days ago. Disease can spread rapidly across borders through travel, trade in human and animal food, infects and other disease carriers. But also climate change and air pollution don't recognize borders, river pollution also. There have been a lot of challenges in the last few years among COVID, the Ukraine crisis, floods in Europe, the climate change consequences. These serious challenges are demonstrating the importance of the system thinking and holistic approach. But crisis also chances for additional policy momentum and also political momentum. And also, I would like to mention the fact that before 50 years, the population was 3.8 billion. And after 15 November last year, we are more than 8 billion people. We made a crowd, maybe, on the planet, and we need better organizations of our activities. It is a good news that the approach to health and discussion about health is increasing. That is very important. I would like to point out that we all have the national levels, at national levels, ministries of health, but all ministries of health are preoccupied by disease solving and monitoring. Majority of tasks are dedicated to solving problems in different non-communicable or communicable diseases, not enough to strengthen health. As a public health expert, I can report that among the health professional community, the majority of doctors, more than 95% are clinicians, and the public health community is very small in the whole health professional community. That is an important challenge. How can we make progress in the human workforce in public health in the line better preparedness for the next cross-border health crisis? We should put health on the table more stronger than ever. With One Health approach, as well as planetary health and global health approach, we can go in the right direction to increase resilience from all challenges: infection disease, climate change, air pollution. As an example, European Public Health Association and the Environment and Health section put One Health as an important topic at the best long-term One Health approach promotion at the EU level is the educational process, strengthening resilience by education and empowerment of networks of national academies of sciences and educational institutions. One of the example of top-down process could be the EU support to member states towards the One Health approach at the national level, giving the support through different EU institutions like ECDC, Joint Research Center, but also SAPEA and other important scientific advisory bodies. Several influential associations like EUFA, European Health Management Association, Federation of European Academy of Medical Sciences, European Public Health Alliance also are also important stakeholders in this process. There are a lot of initiatives in the EU that promote operationalization of One Health. Important to mention that DG Sante also established the Department of One Health. It is also worth mentioning the fact that Horizon Europe is a chance, and there are specific calls dedicated to health. As a member of Environment and Health section of EUFA, I can underline our dedication to One Health and planetary health, also to climate change issues, respecting SDGs and Green Deal in the aim to strengthening resilience and decrease vulnerability of future health crises. And for the end, I can say that it is needed to take a holistic approach to our planet and to health. As we need it in healing the patient, we need a holistic approach in the healing environment. Even though we are aware that multidisciplinarity and cross-sectional approach are very complex, the situation is also very complex and it requires a complex approach. One Health could be, together with other important approaches like public health, planetary health, global health, eco-health, the roadmap for complementary actions using SDGs and Green Deal and other recommendations. As EU climate action, we can implement One Health approach in strengthening resilience to cross-border crises. We should train more discipline, less consumerism, as well as respect and balance in the environment. Health is not only the privilege for the human population, and these crises couldn't be good prepared and solved without collaboration with countries and regions outside of EU. Thank you.
Thank you very much, Maria, for setting out what this One Health approach could look like. It's great to see from the chat that we have so many people working directly on the topic already in the room, and I think it will set us up for a lively discussion in just a moment. But first, I'd like to hear from a representative of another of the key players on this topic, the European Parliament. We have a video intervention from Sarah Cerdas, member of European Parliament from the S&D group. So I will hand over to Sarah Cerdas.
Michael, we don't hear.
Sorry about that, just a moment. I'll try that again. All right, we seem to be having some issues with the audio of that video clip, but we will get it ready and hopefully have it ready to share with you in just a moment. But I would like to invite our other speakers to join us for a response to the points from Simo and Maria. So if I could invite Anne and Sylvie, Simo and Maria and Thomas, all please share your video. Great to have you here with us. And fantastic. Yeah, good to see you all. Anne, perhaps I can come to you first from DG HERA. Watching the initial words from Maria and Simo, what were your thoughts?
Well, my thoughts are not very different from what from all the lessons that have been the lessons learned that were conducted after the COVID, meaning that we can expect the number of disease to increase. We can so we know that we need to be better prepared for that, because the COVID showed us that maybe in some aspect we could have been better prepared. We see also that we are all interconnected, so finding a solution at one nation level or at the European level will not be sufficient. We need to have a worldwide solution. And that's why the cooperation between all of us is very, very important. So I will stop here to leave the floor to my colleagues.
Fantastic. Yeah, definitely. The sense that we need to be all connected and cooperating is absolutely crucial. Perhaps Thomas Hoffman from the ECDC, I can bring you in here. What were your first thoughts?
Yeah, thanks a lot, and welcome everyone. I mean, all the points raised, I fully agree. They were all important. Maybe I would a little bit counterbalance and be more optimistic, because for me things have not changed so much during the pandemic. I mean, there was a lot of homework which needed to be done before the pandemic. There's still homework to be done in the area of preparedness and response, and preparedness response is a continuous cycle. You always have an outbreak, you have a pandemic, you take lessons learned. The most important part is then to implement it, and then you're more or less prepared. So in that sense, I would say we were prepared for COVID more than like 15 years ago. And from H1N1 pandemic 10 years ago. But of course, we are never fully prepared. The circumstances change. And so what we have to do now is more or less just to, like always, take lessons learned, make sure they're implemented, and move forward, understanding that moving forward is not about COVID, it's not about pandemics only, it's really about the next 10 years of regular disease outbreaks, of CBRN threats. And I think there's a tendency to overlook all the regular day-to-day work when only focusing on pandemics. And I think one topic, and maybe I can explain later more what I mean with it, is really that we need to focus more on these dynamic response capacities. We have been really realizing also in the pandemic that's still a shortcoming, this kind of response capacities which are needed in a pandemic, in a disease outbreak, and which are often not captured in current assessment tools. Maybe I'll stop here. Thanks.
Thank you very much for this important reminder that this is an ongoing process of strategic crisis management, that behind the scenes work is constantly ongoing to prepare us. And yes, I'm curious to get into a little bit more about this to hear some more. But perhaps Sylvie Briand, we can hear from you from the WHO. What were your first thoughts on this topic, listening to these opening words?
Yes, thank you very much for inviting me first. And yes, the speakers, I think, highlighted what are the challenges ahead. Personally, I would add some of them. I think we are in the midst of a fourth technological revolution, which means that there are a lot of new technologies that were out there. So, and none of them is positive only or negative. It's always a double-edged sword, and we need really to see what we can learn from this new technology to improve epidemic and pandemic response. Because you have seen during this pandemic, we have used a lot of the approach and tools that were used in the pandemic of the 20th century, quarantine, contact tracing, and all those kind of things. But maybe it's good now, and I think Thomas is right. I mean, we need to always be prepared and improve constantly. But I think what is really important also is not to get ready for the past pandemic by only fixing what didn't work, but also looking at the future and trying to imagine what could be the next event and how can we add tools to our toolbox so that we can better respond next time. The other point I think is really important is to introduce new commodities in pandemic response. I think we have vaccine, we have treatment, all those kind of things are really important, and we need to have more research on those tools. But what we have seen during this pandemic is really that trust was very important. It's one of the elements that allow for a good response. And like for any crisis, I think trust is at stake and can be really destroyed very rapidly if you don't protect the trust, and also if you are not starting the crisis with a high level of trust. And you see that now most of the societies around the world, there is a mistrust that has grown a lot during this pandemic. Mistrust in the science first, mistrust in health authorities in most of the case, mistrust even in governments in some places. So I think this trust issue is really important, and we need to address it. And unfortunately, because it's multifactorial and it's complex and it's context dependent and historically dependent as well, it's very often forgotten. And I think this is a very important issue to include in the capacities and in the plan that we will have for the future. And my last point will be on equity, because I think, as we said, that pandemics and epidemics don't respect border. I think the equity should be the basis. I mean, if we are really serious about it, we need to think about equity when we do the plans. It's equity within national borders, making sure that no one is left behind within the national borders, but also think about what will happen in the rest of the world, because this time, I would say that with the emergence of new variant, the disease became more transmissible but less virulent. So it was good. I think we were lucky, but we don't know if next time it will be the same. And as we are so interconnected for economic reason and trade reason, this is the soul of our society is interconnectedness. So we need also to think how are we going to manage a global event if some countries in the world cannot have access to countermeasures and will remain pockets of transmission, pockets of disease in the world. So no one will be safe until everyone is safe. But unfortunately, this equity aspect is rarely taken into account in the plans, and with reason. I think every government, when they want to implement measures, they first think at their population, the one who have elected them, and it's normal, and they will serve in priorities their own citizens. But we need to think more globally when we talk about preparedness for epidemics and pandemics, because those issues cannot anymore be dealt as national level only. And it was said previously, we need to think global more and more.
Absolutely. Thank you very much, Sylvie, for highlighting some of the core elements of our approach there that I think we will certainly come back to, the notions of trust, of equity, adding to this One Health approach to strategic crisis management. Thank you very much. And I see as well that the chat is already starting to buzz with some questions and comments. But first, I would like to try again to share the video of MEP Sarah Cerdas. I'm hoping this time now with the sound. Let's give it a try.
Hello, everyone, and thank you very much for having me here. It's a great honor and opportunity to be here with you and speak on this very exciting conference and on the specifically on are we ready for the next cross-border health crisis. So I'm trying in this initial intervention to answer to three very important questions. Are we ready for the next pandemic threat? Are we ready for the next health threat? I hope so. That's what we have been doing tirelessly since the beginning of the pandemic. So we have been approving a new regulation for serious cross-border health threats, which I was one of the main negotiators, and we also reinforced the mandates of two of our agencies, the European Center for Disease Prevention and Control and European Medicines Agency. In this regards, Parliament was a co-legislator. It's a co-legislator, so we always do the legislation together with the Council. There was also the appearance of a new figure in the Commission, which is HERA, the European Health Emergencies Authorities, and all of this made us stronger to address the next health crisis and the current crisis that we're living. COVID is still not over. Winter season, we know how difficult it can be. So we worked tirelessly to have better prevention, preparedness, and response within the EU with better coordination. Because when it comes to provision of healthcare, that's a member state's competence, but according to the treaties, protection of public health is a shared competence between the EU and member states, and that's what we're working at now. When it comes to when do we know when the next pandemic we have reinforced our surveillance networks, and epidemiological surveillance is very important for us to be ready to respond if necessary. So that comes very importantly on the preparedness part, and we're also going to have better coordination. This is of the utmost importance, but we need to understand it's a multi-level approach. It's EU with member states, the agencies, but also you have the national public health authorities and the regional and local health authorities, because then it's up to the configuration of each member state. Here I would like to reinforce that we actually strengthen the need for better training for health professionals when it comes to health crisis for the next pandemics, and this is something that the ECDC is working on. And we also must not forget that we have COVID, winter season, we have antimicrobial resistance, X disease that WHO identified already in 2018, describing it as a virus similar to what we have with COVID-19. When it comes to, and we need to be ready for that. And within this, having this said, when it comes to governance, we need governance across the EU. So this is something we're talking on with the Commission. We have HERA now. We have going to revise HERA's role as a Commission department, or if it should be a standalone agency, and it's working very nicely on coordinating with member states on the response and coordinating response. We've seen it with the different variants of COVID-19. When it comes to addressing the needs of health and specifically on health crisis, I truly believe that we are ready, but still there's some work to be done. And we're still working on the COVID-19 lessons learned, and we're now negotiating a report which will be the European Parliament's position on what went with the pandemic and what we can do better. And after we have those conclusions, not only on the health part, but also on the socioeconomic, democracy, and global health, we're going to share them with you. So I'm quite excited to be also involved in that. So thank you very much for having me here. I hope that was a bit clear, and what we're working on, what's the role of the European Parliament. But without doubt, we are stronger if we work together. And when it comes to health, we must never forget that protection of public health is a shared competence between member states and the EU. So we must always work together, because when it comes to communicable diseases, virus, bacteria, fungi, parasites, we are only stronger as our weakest link. So we must stand together. Thank you very much, and I wish you a great conference.
Thank you very much, Sarah Cerdas, MEP, for joining us there. And I'd like to invite all of you participating to start to post your questions and comments and thoughts in the chat. Don't forget, you can select to everyone so that all participants see your questions and comments. And our team will be messaging you privately to ask if you might like to join the discussion, to later switch on your video and audio and join the discussion with our panelists. But for now, I'd like to come back to our panelists. So please all do switch your video back on. Anne, Sylvie, Thomas, Simo, and Maria. We've heard quite a bit already, setting out the scene a little bit. And I would love to come back to Maria and Simo at this point to hear a little bit your thoughts. We've talked a lot about lessons learned from COVID. But what would be the key recommendations you would make in terms of what we can draw from our experiences of the last pandemic? And perhaps I can come to Simo first.
Thank you, Michael. I think we all were talking about the same issues, that it's important to raise awareness and equity and trust in all levels, and then there are the whole of society or whole of government, One Health approaches, and then development of international and regional confidence and collaboration. I think that's in a nutshell what we are all talking about. But actually, the lessons learned from COVID is of course, a pandemic is mostly a bad thing, but we have learned some important issues as well, and for example, telemedicine and teleconferences and such, they have evolved rapidly, and from a microbiological point of view, because that's where I'm specialized in clinical microbiology, is that we learned that it really is possible to prevent spread of respiratory diseases, but so it's not an impossible task. So, for example, influenza A epidemic stopped like in a wall when we started the isolation procedures with the pandemic. Thank you.
Yeah, absolutely, and I think this connects with the point that Sylvie was making about the advance of new technologies, and that perhaps there is reason for some optimism there. Maria, do you share this optimism?
Yes, thank you for these thoughts. I also think that we have some positive results as a COVID pandemic process, like telemedicine, like communication by Zoom webinars. We maybe stopped physical communication, but we continue social communication, learn how we can continue among us by some other social media or by webinars, exchange experience. And I think that it's very important to continue with that, and also use capacity to increase solidarity. I think that it's also a keyword, to increase solidarity, to work also outside with the countries outside of EU, and also to strengthening trust between science, governance, politicians, and citizens. And make some kind of balance of basic needs and the quality of life. And I would like to remind all of us that we are have almost 3 years of crisis, but with electricity and with water supply. And I think that we establish basic needs for all of citizens. And I think that we should think about future crises as a crisis linked by climate change, floods, and maybe synergy with other important environmental factors. And maybe these crises could be much stronger for all of us. And as I mentioned in my speech, that we are a lot of people in the planet, and we should organize better our basic needs, communication, traveling. So this meeting, it's not necessary to be alive if we want to be exchange the thoughts. So it means that we save emission of CO2, for example, and risk for exchange some viruses or other factors for risk. So I think just underline that importance to changing and improving curricula at faculties, not only medical, but also to use knowledge for future generation.
Absolutely, and I think you've really underlined there the need for a focus on basics that underpins this concept of equity we were discussing earlier. And I like that you mentioned the possibility of what the next crisis could look like, and that was something I wanted to ask all of our panelists. You mentioned that we could imagine that climate change and flooding could be at the heart of the next cross-border health crisis. But I wanted to ask our other panelists, what do you see as the potential next big cross-border health crisis? If you had to make a prediction. Thomas, maybe I can come to you on this one.
Yeah, thanks. That's a hard question, right? It's almost like betting on horses. I mean, it's something will come for sure. I mean, sometimes we are surprised, right? Last year, all of a sudden, everybody's still focusing on COVID, and then Mpox hit us, and we were kind of facing a complete different challenge, different stakeholders in member states, different type of risk communication needed, different type of contact tracing needed. So I don't know if it's so important. What I think is important, and that's something which often, like, we tend to do after big events, we tend to throw out the baby with the bath, right, and say like nothing really worked. I think we should just keep going what we have been doing before. I mean, it was clear before that we need to strengthen multi-sectoral coordination. It was, and what Sylvie nicely pointed out, new capacities are needed. I mean, this whole issue of risk communication, community engagement, again, monkeypox showed it clearly, it's a capacity needed. So, and often also what happens, I think, is that we tend to expect too much from the international level. I think all international organizations, European Commission, ECDC, WHO, of course, we will do our utmost to support member states. But there's also issues which we simply can't do. We can't do the homework of member states. Member states have to do after action reviews, to do simulation exercises. And we also, I mean, risk ranking, and that's maybe more important than doing the predictions of what's the next cross-border health threat, to have a clear national profile on what are the risks and how do we prepare for it. I mean, I know that HERA, for example, and we also have our work ongoing on getting agreement on some lists, which for the EU level is also important, but it's also important to do this on a national level. There might be specific needs and there might be specific gaps when it comes to multi-sectoral coordination, to capacities. And I think, of course, sometimes we also make it ourselves too easy. I mean, and again, I don't want to throw the baby with now in saying like all the assessments from before did not work. but just to flag that from my point of view, we focused also too many years on implementing the rather static IHR core capacities. We had the JE tool developed, which is a checklist approach, but which does not capture dynamic response capacities. It does not capture the quality of risk communication. You can ask a country to have a risk communication plan, but it does not capture the quality of it. The same also for contact tracing, the same for decision-making processes, governance. What role does public health have in decision-making processes? How is public health linked to the national crisis management function? Who designs, implements, and monitors public health and social measures? I mean, there's a whole field of which is not at all included in any of the current assessment tools. So I think there's a lot of homework, of course, also for the international level, but I see it also a lot on the national level right now to really see, to fix things in the national emergency plans, to revise legislation, to clarify national crisis management structure. And I think by doing so, we will be able to have operational capacities ready for any next crisis, and also be able to share information. I mean, that's the other part of the IHR core capacity. That's one part, but the other part is the day-to-day operational use of the international health regulations. And I think in becoming better there, in all of this dynamics, I think we will definitely be ready for any next time in whatever way it will, however it will look like.
Okay, so yeah, it's absolutely at national level that you seem to have identified some real key gaps, areas where European member states need to work. And I'm looking at Anne and Sylvie, imagining that for the two of you, as your work at European and at global level, this must be something absolutely crucial, that there's only so much you can do at an international level, and that when it comes to it, it's the member states that need to step up in a lot of areas. Maybe I can come to you first, Sylvie, on this. How do you see this challenge?
Yeah, so my specialty is really epidemic and pandemic, so I will focus on those events. But I think as we have seen with COVID, we cannot predict which pathogen will emerge and which one will become a pandemic. So in my opinion, a lot of effort should be invested in preventing emerging pathogen becoming pandemic. And so to prevent them, this is where the One Health approach is so important, but not a One Health approach encompassing all type of interface between human, animal, and environment, but really focusing on what kind of activities can we do at this interface to prevent emerging disease to become epidemics and then pandemics. So I think, but that has to be very concrete. And so this is one thing I think we should do in the future. The second thing is really, if you look at in terms of risk, what are the risks that are more likely to happen, or what are the things that are more likely to happen? I think respiratory pathogens are very likely to cause a pandemic in the future. So again, I'm not predicting anything, but just in terms of why they are more likely, because first of all, everybody needs to breathe on Earth. So, and you need to breathe a lot. So you cannot stop breathing, basically. So that's why it's very hard to stop transmission of a respiratory pathogen, and it can affect anybody. Secondly, most of the respiratory pathogen, they are transmissible before people show symptoms. So there is a lot of transmission that happen before people know even that they are infected. So a lot of the things you can do, for example, for Ebola, don't apply at all for respiratory pathogens. And so, for example, contact tracing is very efficient in Ebola because people are contagious only when they show symptoms. But for a respiratory pathogen, it's not the case. And you have seen with COVID, people could transmit 2 days, 3 days or more before they show symptoms. So the management of transmission with respiratory pathogen is very challenging, and they spread very fast. So for all those reasons, I think countries should be ready for such kind of event, because I don't know the likelihood for it to happen, but what I know is that when it happens, it will be challenging. So we need to get ready for that. The second type of risk I think that we see growing currently is really vector-borne disease, especially due to Aedes aegypti. And because first the mosquitoes are, because with climate change, you see that the geographies of those mosquitoes is extending. And so now you can find them in places where before they were not used to breed so naturally. And some of those mosquitoes are infected with diseases that are dangerous for humans, like dengue, chikungunya, Zika, or yellow fever, or whatever. So I think we should get ready also for those type of events in terms of, well, of course, there are many other risks that we are monitoring. Thomas was mentioning mpox. Of course, we have seen an increasing risk of mpox in the previous year, but everybody was so busy with COVID-19 that, of course, the risk has not been monitored so well in the past few years. And partly part of the expansion of mpox has been the fact that we have had a lot of international mass gathering when COVID was less prominent, and those international mass gathering have really facilitated the transmission of mpox outside the normal natural endemic areas. So now it's something we have to live with as well. But I think it's important not to necessarily focus on certain risk. And now the recommendation we are giving to countries is that we need rather to look at groups of pathogens by transmission mode, so that you can have ready, for example, if it's respiratory pathogen, you can have your stockpile of masks, your stockpile of antivirals, a number of things that can be pre-positioned so that you are better placed when it happens, and maintain this preparedness attitude all over the time. And my last point, I think, which is I think an important point, is that we have been working a lot during this pandemic at WHO on infodemic management and all the new information ecosystem that in which we are living currently, based in part with the new technology. And I fully agree, Marija, that it's great to have Zoom call and telemedicine, and this is absolutely great. But the other side of the coin is that also that rumors that have always existed in any outbreak or epidemic, now they can spread also further and faster, like for viruses. And so I think it's a very important phenomenon, because, you know, even if a pandemic, even if one pathogen emerge and it's not creating a lot of cases and death, but imagine, for example, let's say 7 cases of smallpox re-emerging before a big mass gathering in one of the capital cities in the world. You know, the impact of those 7 cases may be enormous, just because it will create fear, panic, maybe border will be closed, etc. So many things can happen. And we know that those kind of things are very fast, because when South Africa declared the new variant Omicron, I don't know if you remember, but a few days later, all borders were closed, and they couldn't we even had difficulties to ship the virus to our biohub center to make the sequencing and the sharing of the virus. So just to say that sometimes even small event can have a lot of impact. And so we need also to get ready for this kind of event. Yeah, thank you.
Absolutely, and thank you very much for painting a picture there of the type of situation we could be facing. As we say, it's difficult to predict, but yeah, you make some very clear points about the importance of preparedness. Anne, I wonder if I could come back to you. HERA is a relatively new department at the European Commission, created since the COVID-19 pandemic. And I wondered if I could come back to you about this challenge of coordinating activity of member states at national level, the role that Europe can play, and the limits to the influence that Europe can have, and hear your thoughts on this.
Yes, thank you. And well, I tend to agree with what Thomas and Sylvie have said. It's not important to know what will be the next event, but to try and control some aspect of the events that may appear, because we call a crisis when there are many aspects of that event that we cannot control and manage. So our responsibility as the EU, as member states, is to make sure that we understand what needs to be done to control the event, how we can increase efficiency between member states and the European Union and different actors that will be involved in that crisis, and how we can better prepare. So ERA was created just well in the middle of COVID, because we realized that one of the problem during COVID is the access and the availability to the relevant medical countermeasure to deal with that crisis. Having medical countermeasure is one of the aspects. There were many other aspects to deal with COVID, but ERA was created to make sure that at least we have the medical countermeasure available. And how do we do that? We will try to do that by ensuring that the entire value chain of medical countermeasure is covered. And the EU will not do that on its own. We have a very specific governance in ERA. So we have the ERA board, which is a board of member states that guide us with all strategic decisions. We are working with the Joint Industrial Cooperation Forum. So it's a group of industries that have been nominated to brainstorm with us on what needs to be done to address a specific cross-border health threat. We have also a civil society forum, which is guiding us on what is important for the society when talking about medical countermeasure. And for every action that we are implementing, also we can have recourse to a specific group, for instance, with a scientific expert who will give us their advice across Europe on the medical countermeasure. So we are, as I said, we are working very closely with member states throughout the production chain of medical countermeasure. So the first thing that we will do first is to understand what are the threats ahead of us, and we have identified 3 priority threats, which are CBRN threats, pathogens with the potential of pandemics, and disease affecting disrupted by the antimicrobial resistance. So it's important to identify those threats, because that's what helps us to identify what are the medical countermeasures which are relevant to address those. So either we don't have the medical countermeasure, it means that we will need to develop, and that's the reason why we will use the budget of Horizon Europe to focus on the development and the research on innovative medical countermeasure. Maybe we need to develop the medical countermeasure, so we will have also budget to develop those new vaccine or therapeutic. And that's important that we do that, because member states do not necessarily have the budget to do that, because they have many other priorities. Then we will try to ensure that the capacity is sufficient across Europe to ensure the sustainable production of the relevant medical countermeasure. And in some case, we will procure for the member states. It was the case for Mpox, where member states came to us and say, we don't have access to the manufacturers, because it's a rather small manufacturers. They don't pick up the phone, so could the Commission purchase for us? And that's what we did and that allow us to provide the medical countermeasure very quickly on Mpox. And finally, and I will stop here, we are also, because we know that in time of crisis, we need to respond very quickly in the first hours. So that's the reason we are building a very thorough stockpile of critical medical countermeasure to address CBRN threat, but also other type of threat like Ebola or Marburg, or also some antibiotics to address the antimicrobial resistance. So that's really in a nutshell what we are doing. And again, we are always paying attention not to take over the responsibility of the member states, but to work with them to make sure that what we are doing is together is efficient and effective. Thank you.
Thank you very much. So yes, finding that balance between making sure that Europe is coordinating and they're playing an important role when needed, but also that the member states are also stepping up when needed. You mentioned stockpiling, and I saw there was a comment in the chat from Annika Eberstein. I wonder, Annika, if I can invite you to join the conversation now. We can have another half an hour to keep the conversation going. I wonder if I can invite you to join the panel and share your video and audio. Great. Hope this seems to be working. Yeah, I know you had a couple of points to make, one about stockpiling and one about implementation in connection with other crises. Would you like to make a point?
Yeah, sure. Hello. Good afternoon, everybody. No, I just had two questions. So the first is that, well, it's a terrible fact that climate change is not only leading more to increase the risk of pandemics, but also other types of natural disasters. And so I was wondering if the experts here on the call have any views on how these types of different crisis response mechanisms should work together, or maybe already do work together, be it at national or international level, because they all require medical responses as well. People get hurt in national disasters. And then the second one, as mentioned, on the stockpiling strategy. So here again, just a question if there are good recommendations from the expert in the room. What could be principles for the stockpiling strategy, be it in terms of procurement for stockpiles, in terms of deployment or others, and the synergies between different types of stockpiles at different levels of government.
Thank you very much. So perhaps for the first question on how is preparedness interlinked with preparedness for other types of threats like floods or wildfires? Any takers for this, or
I could.
Anyone? Yeah, sure. Go ahead, Thomas.
Anyone else probably has something to share as well. I mean, that's something we would very much have as a basis for our work with member states to say. We don't need to build up specific systems for all sorts of threats. Of course, for respiratory diseases, you need to have a specific focus on how to deal with them, and for others, you need other measures. But generally, the way how to bring together certain sectors to do emergency preparedness planning, I mean, same things apply. But also, I would like to mention that, of course, a lot of EU legislation has been revised, and a lot of agencies have become a new mandate, including ECDC. And ECDC has been tasked to set up the EU Health Task Force, which is now a globally deployable rapid response team for preparedness activities, for response activities. And it is meant to be supporting member states for any sorts of crisis. So, I mean, member states, EU member states, but also it can go anywhere globally, can request support. And this, again, is an all-hazard approach. I mean, this can be helping with floods. This can help with a disease outbreak. This can help with revising a national preparedness plan. So I think this is really some flexibility, but also really a very important, useful tool for the future, I think, for the EU to have such kind of a response, preparedness and response team. And I think just to flag that, of course, we're in close contact with the GORN network, because, of course, for response, I think we have been better so far anyway. There have been many activities, but for preparedness, we didn't have something like this before. And I think even in response, the EU can get stronger. So I think in that sense, we also try to set this up in close collaboration with existing rapid response teams, but again, having also an additional focus on preparedness.
So hopefully this interconnected approach should result in a interconnected implementation as well. Maria, would you like to comment on this one too?
I would like just to add, I already mentioned the Horizon call, and that is the chance for responsible research and innovation regarding climate change and the future crisis also, and that we can expect in the same time environmental issues like climate change and different floods and environmental factors negative, and also increase of risk of some infectious disease. And also I would like to mention that some areas are more vulnerable than others. For example, Western Balkan areas is more vulnerable regarding climate change than others, and we can expect in the future, for example, as already mentioned, malaria or some old new challenges regarding infection disease. So we should learn much more about infection disease. We should add some new areas, and that is also important for us medical doctors, but in connection with climate change.
Okay, so really connecting those up from the start. Simo, I wonder if I can come to you on either of these questions, so on stockpiling or on this interconnected crises. The SAPEA evidence review report covered quite a lot of ground and made recommendations on some of these topics. I wondered about your thoughts on this. Oh, I'll just...
I don't really have much to add to the previous discussion. Thank you.
No worries at all. Thanks very much, Annika. Maybe to come to the stockpiling point in that case. What would your recommendations be in order to prepare us, for example, to set up field hospitals quickly? What recommendations can we make on stockpiling? Maybe maybe Sylvie, you would have some thoughts on this.
Yeah, I think our experience on stockpiling is at first, the problem with stockpiling is that you keep a stock of things. So first is the space to keep all those things. And secondly, as the expiry date, because you have to replenish your stockpile regularly. So I think for us, because we do have stockpile for global level, and the best thing is first to have a virtual stockpile, meaning that it's a manufacturer who keeps the stockpile and it's a rotating stockpile. And so that's why it's better to choose treatment or vaccine that are used in general for other purposes, and then but you can scale up and you have some stockpile in case of a crisis. And for example, for flu, what we do is that the process of producing a new flu vaccine has different steps. So we try to advance the process as much as we can. So currently we are at the stage of a seed virus for H5N1, but it's not finished. We have not finished the process. Just if we have a pandemic due to H5N1, then we can start the production and have enough doses in a shorter time frame. Because so I think we shouldn't only see stockpiling as a physical stockpile, but I think there are many new modern ways to stockpile, or at least to get ready. And it could be stockpiling of seed virus rather than stockpiling the vaccine, the full developed vaccine, etc. And I think in case of stockpile, it's also very important again to record that if it's a global event, then we will have to think of the geographies of those stockpiles, because if borders are closed, then you cannot access the stockpile you wanted to have access to. So I think stockpile strategies are really important and key, at least for the first few weeks of a pandemic or an epidemic. After that, I suppose things can normalize, but at least, so what are the key essential we need to have at the beginning? And for most of infectious disease, it's something very basic. You will need soap, you will need water, you will need, things to ensure IPC and some mask, etc. So there are things that are fairly straightforward. So what we have done at WHO, we have done packages by type of disease. And so we have already a list of items that needs to be ready, and we can also procure and ship them to countries affected by crisis. So instead of having a full stockpile, but we do have stockpile as well, physical stockpile, and they are in Dubai. So hopefully it will work for the next
so
pandemic.
combining the physical and virtual. Yes,
Yeah,
Anne, did you have some thoughts on stockpiling as well?
Yes, sorry. No, just to respond to Annika, and we have just started a process with member states on stockpiling and defining stockpiling strategies for the EU. So indeed, we have a big, we are preparing a big stockpile for basically low probability but high level impact. So that's those stocks will be secured under rescue, which is managed by DG ECO and funded by ERA. But we are also working with member states to define what should be their national strategy on stockpiling. We know that some member states are very well prepared, others maybe are less prepared. And so we are working with them on that. We have had a workshop recently, and we will have another workshop in June. We will also discuss with industry and the civil society. And the idea is to issue a communication soon on stockpiling strategy for the EU. So it will come.
Great. So work is underway.
Yes.
Annika, I hope that answers
Thank you
your
very
question.
much. Very elaborate responses.
Thank you for bringing your points in. And I would love to bring in another point. I saw from Sarah Bengtson in the chat, and I wonder if I can invite you, Sarah, to join us. You were asking about, coming back to that point about equity. I wonder if you'd like to share your video and put your point to the panel.
Yes, thank you very much. My name is Sarah Bengtson, and I'm involved in a joint action on strengthening the IHR implementation in countries in the EU. It's called Joint Action SHARP. And just to comment on the homework that countries have left to do, we just had a final report that is still in the draft, where we have looked at the state party annual reports of 12 lower GNI countries within our group to see if they've advanced their IHR core capacity based on those reports. So it doesn't get into the depth detail, but rather the self-report from the countries. And we have seen that in areas where we have focused our joint action, that those areas did advance from the SPAR 2019 report to the SPAR 2022 report in that group of countries. And those are surveillance, lab capacity, risk communication, and chemicals, which were the focus that they had decided to work on. Now, given that the tool has changed over that time as well, and that this is a self-report, we see this as a very good example of countries that have worked to advance their IHR strengthening and coordination mechanisms during the pandemic. So my question to the whole panel is, even though we're never going to be fully prepared, that has been acknowledged, have you seen advances in core capacities among the countries because of the response to the pandemic, as we have seen in our joint action? Thank you.
Thank you very much. And please do share some more information in the chat about the action you've been working on. I think it would be interesting to hear. So maybe yes, to our panel, who would are there member states that you would pick out as examples who have made particular progress on this? I wonder who I can turn to on this question. Yeah, Sylvie, sure.
Yeah. No, I think I will speak globally, so I've no, but I think in general, countries have improved significantly their diagnostic capacities. Many countries have been supported to do PCR testing. And I think there is great hope with those rapid tests that can really allow diagnostics even in remote places, which is where very often the access to care is very low. And so it's important to have a clear diagnostic. I think the second progress we have seen that, in my opinion, is very important is the issue of care. because really before, I mean, maybe it looks old now, but I remember the first Ebola outbreak I was involved in, there was no treatment. We didn't consider to treat patients. It was even now we have Ebola treatment center, but before it was Ebola isolation center. And we were just isolating people so that they cannot contaminate the rest of the community. I think with COVID-19, more emphasis has been put on care, and that we need to treat people. Treatment is important, and health system needs to be ready for treatment as well, which has not been the case everywhere. So some countries have done a lot of progress with this, with special wards for COVID, special ways of organizing the system, like fever clinics, or I mean different ways of organizing the health system so that it can you can offer scalable care in case of need. But I think we need to continue in this direction and continue to emphasize the need for care, because at the end of the day, a pandemic or an epidemic is a disease. And I'm fully supportive of the whole hazard approach. But whether it's an earthquake, a flood, or whatever, you will need a healthcare system. And so it's very important also to make sure that our healthcare system are robust, are resilient, and able to deal with different type of threats. Thank you.
Thanks, Sylvie. So there is progress there on testing, on care. I wonder, Simo and Maria, if I could come to either of you on this. We're talking about this One Health approach. Is there evidence or examples you would pick out of where you think particularly good work is being done on preparedness? Maybe Maria?
So I can just mention that for example, in Serbia, but in the other countries, we have some case studies and examples and good cooperation in the Ministry of Health and the Ministry of Agriculture and the Ministry and the Department of Veterinary Medicine regarding, for example, brucellosis or other infection disease. And these examples lead us to decision to make common master programs for students in veterinarian medicine, human medicine, and agriculture, for example. It is very important, and also but I would like to mention that all these experience after and during the COVID maybe lead us to include more social sciences to investigate human behavior for the future crisis, the better preparedness for the future crisis. That is my vision.
Right. So a real interdisciplinary approach. And Simo, I wonder if I can come to you on this. I know that in Finland, there was a particularly strong example of a whole society approach to crisis management. Would you like to share a bit your thoughts on this?
Yes, thank you, Michael. I was going to come to that. In the SAPIA report, actually, there's a case report describing the Finnish security strategy for society, and that's a whole of society approach. But coming back to the previous discussions, preparation is not only stockpiling. I think what should be emphasized is that we should strengthen essential public health functions and training and education of healthcare and other professionals. Thank you.
Yeah, absolutely. The importance of making sure that Europe has the capacity and is constantly focusing on this capacity moving forward. Yeah, absolutely.
So it's not only material; it's not knowledge.
That's it. Yeah, our resources go a lot more broadly. I hope Sarah, this has responded to the point you made.
Yes, it has. And Simo, we'd like to thank THL in Finland. They coordinate the entire joint action. So thank you. And thank you for your time.
Fantastic. I'd love to bring in one more speaker into our fishbowl. I was wondering, I noticed the question on transparency from Paul van der Werf, and I wonder if I can invite you to join the panel with a focus on transparency in research. Paul, would you like to put your points
yes.
to the panel?
Hi, well, thank you very much for inviting me into this panel, and there's been a great discussion so far. So I agree with the need for a One Health approach, and as well as more transparency and cooperation between member states to prepare for cross-border health threats. However, like Simone Nicari highlighted, that dual-use research, and especially in biological research, is a key consideration for preparing for future crises. And so I was wondering, so like given the geopolitical tension, also considering the Russian invasion of Ukraine and also the increased tensions with China, for example, how can we ensure there's sufficient transparency in dual use research and improved cooperation in that sense when it becomes technology that is highly sensitive, I would say. So thank you very much.
Okay, so dual use, so these technologies which are developed for a purpose perhaps in agriculture or in other areas, but which also could potentially pose a biothreat. I wonder if one of our panel would have some thoughts on this. Anybody like to take this one? Simo.
Well, we did mention already we need trust and we need confidence building measures and then we need collaboration. Thank you.
Yeah, absolutely. So building this trust. Sylvie, perhaps you also have some thoughts on this.
Yeah, I think it's true that geopolitical tension are certainly making a trusted environment more difficult to achieve. But I would like to highlight that during the Cold War, US and Russia managed to work together to eradicate smallpox. And it was a success. And so I think when it's about health, if we manage to protect health from the geopolitical tension and craft a special space for health discussion, we might still achieve something, provided we because at the end of the day, I mean, it's for the benefit of everyone. If we can have some kind of regulation and transparency and discussion, if we cannot put the risk down to zero, at least we can minimize the risk by having a common understanding of the threat and that each country puts in place some regulation that will minimize the threat. Thank you.
Thank you very much, Sylvie and Paul. I hope that responded to the point you made.
Yes, thank you very much.
Thanks a lot. Time is not on our side, unfortunately, and we just have 5 minutes remaining, but I would love to hear from each of our panelists. What will you take from this conversation? What final thoughts would you like to share with us? And perhaps on this, I can come to Simo first. What would be your takeaway message from this?
Thank you, Michael. I'm already repeating myself, but raising awareness, equity, and trust in all levels, and this whole of society, whole of government, One Health approaches in the national level, and then development of international, regional confidence and collaboration. But a new point is that we should keep up the momentum to prepare against these cross-border threats, and we should not forget them, because the question is not whether we will have a new pandemic, it's when will it happen and what will cause it. Thank you.
Thank you very much. So yeah, very much keeping this high on our agenda. I wonder, Anne, if I could come to you next for your takeaway message from this discussion.
Yeah, my takeaway message would be to repeat words that have been already mentioned during this webinar. The first one is trust. We need to ensure that there is trust. And by listening to everybody today, I realize that we are on the same footing. We have a good understanding of the situation, of the challenge ahead of us, ahead of us. So I think we need to continue the building the relationship between the partnership, because that's when a crisis hit, that those partnerships and those relationships are important, because we would have the trust that is needed to respond to a crisis. And then investing in innovation, investing in research, making sure that we understand the threats that are coming our way. That's also very important, and that's what we will continue to do in ERA. Thank you.
Fantastic. Thank you very much, Anne. Sylvie, perhaps I can come to you next on this from a WHO perspective. What will you take from this discussion?
Well, first, something very positive. I think there are more and more people understanding the threat of infectious disease and pandemics and epidemics, which was not the case necessarily before COVID. So, but we need to build on this momentum, as Simo said, and avoid this cycle of panic and neglect, which has been the case in the past crisis, and probably be concrete, really concrete in what we mean by preparedness, and because sometimes success is made of multiple small steps. And so, but still we need to have those small steps. So I think being concrete and really list the 50 most important thing that we need to achieve before next year, I think would be a good way to start being more prepared. Thank you.
A very concrete proposal. Thank you very much, Sylvie. Thomas, perhaps I can come to you next on your final thoughts.
Yeah, thanks. Now I'm of course risking to repeat what has been said, but definitely, I mean, what I really, I think was kind of common denominator really was this strengthening of collaboration partnerships, combined with training of stakeholders. I think that's really a capacity which will endure also in future crises. But yeah, as Sylvie said, it needs to get concrete, and I think this new EU legislation will also require, for example, for all EU countries to revise their national pandemic preparedness plans, and will require legislative changes. And I think without those concrete legislative measures, a lot of the kind of technicalities, we can work on them now, but when a crisis hits, the law will still be the one where which the country will use to respond to a crisis. So in that sense, I think we need to also encourage countries really to, I mean, not only to encourage, I mean, per legislation, it's anyway the next step now, but really also from the national level, we will be ready to support countries in that process to make sure these issues of governance are addressed also in legislation, and that processes and dynamic processes are in place, so that all the potential can be used, and all the capacities can really be used to the extent they are needed in the next crisis.
Thank you very much. So yeah, hoping that this push from European level can see some really concrete results at national level too. And finally, Maria, perhaps I can come to you. Yes, what will you take from today's discussion?
Just one sentence. Health is strong argument for cooperation, responsible research, innovation, changing behavior, and with the aim to increase resilience and always save peace.
It's a very loud and clear message. Thank you very much, Maria. And thank you to all our speakers for joining us at today's webinar. You were highlighting the importance of keeping the momentum going on the topic of strategic crisis management. And I think today's discussion has gone a long way to do that and to keep things moving. And we want to keep these conversations continuing at CEPEA. So please do check our website for updates on upcoming events, discussions, and activities. And a massive thank you to all of the participants, those who joined the discussion and brought your points to our panelists, and to the rest of you for joining in the conversation in the chat and for joining us here. We're very grateful. A big thank you to all of you for today's event, and we look forward to keeping the conversation going.